Dr. Abi, we are from T01. I'm the group leader, Esther Liu, and this one is Yimon, Suzu, Natalie, and Agnes. So today we are going to present one of the medication error, which is wrong dose. Introductions, key scenario, role play will be presented by me. Pharmacotherapy will be presented by Agnes and Yimon. Adverse outcome of insulin will be presented by Suzu and Natalie, which is Natalie will present undesired outcome of insulin. Now we're going to talk about the introduction. How many people died because of medication error? From CNBC, Johns Hopkins study claims that more than 250,000 people in the US died every year because of medication error, and other reports claims that number can be as high as 440,000 medication error. And medical error are the third leading causes of death after heart disease and cancer. And from CNN News by Lydia Lam, reported that elderly woman accidentally give 10 times prescribed drug dose at SGH and was pronounced dead 2 days later in an SGH ward. So this shows us that medication error had caused harm to people. So for our key scenario is Madam Lim, 65 years old, was diagnosed with diabetes mellitus type 1, and the doctors had ordered extra-rapid insulin injection to given to her before meal, subcutaneous before meal, extra-rapid 0.5 units on morning. And the staff nurse Yimon gave the wrong dose of medication to Madam Lim due to her carelessness. So now we will play a short role-play video.
Madam Lim, 65 years old, diagnosed diabetes mellitus type 1. Doctor has ordered an extra-rapid insulin injection to be given her before meal, subcutaneous before meal, extra-rapid 0.5 unit on morning.
I check whether this is the correct medication, which receive it, and scan, check. Dosage, it's 6 units. Hey, madam, you cannot go off the bed. Hey, madam Tan, where are you going?
I want to go toilet.
You go toilet, but then you can press the call bell and then call the staff nurse over. She'll help you go toilet, okay?
Oh, okay, because I might call you, never see me.
I'm sorry. Madam Tan needs to go toilet.
Okay, I'll bring you, Madam Tan.
Hey, Madam Lim, I'm going to give you insulin, okay?
Okay.
Finish. Thank you, Madam Lim.
Thank you, nurse.
Good afternoon, Madam Tan. You feel okay, your leg?
Yeah, okay.
Okay, Good afternoon, Madam Lim. You look so pale.
I feel dizzy.
Meeting.
Yeah, just now the nurse gave me
Insulin. Do you feel any headache? Oh.
Yeah, I feel dizzy and feel like vomiting.
Okay, you rest for a while.
Okay.
Are you in charge of this room?
Yeah.
Your patient, Madam Lim, said that she feel vomiting and a bit giddy after you gave her insulin. How many doses that you give her?
I give her 6 U.
Check whether it's correct or not.
Okay. Oh no, 0.5 U, medication error.
Go and check patient vital signs and inform the doctors and write an incident report to me.
Can I take a BP?
Oh, okay.
Okay.
Hello, I'm Agnes. Now I will present about the pharmacotherapy of insulin. Insulin is a protein hormone that is used as a medication to treat high blood glucose. This includes in diabetes mellitus type 1, diabetes mellitus type 2, gestational diabetes, and complications of diabetes such as diabetic ketoacidosis and hyperosmolar hyperglycemic status. The purpose of insulin are restore metabolism to normal. It also avoids symptoms due to hyperglycemia and glycosuria and also help prevent complications. The common side effect is low blood sugar. Other side effect is include pain or skin changes at the site of injection. Treatment of insulin is according to requirement and convenience of each patient by testing urine and blood glucose level. Type 1 is usually 0.4 to 0.8 U per kg per day. Target is obtained basal control, multiple 2 to 4 injection daily of long and short acting or long acting with oral hypoglycemic.
Hello, I'm Yvonne. I'm going to present on the effects of insulin in the body. So first, insulin is produced naturally by the body in the pancreas. And eating food will trigger this process, and the insulin is released into the bloodstream. But for a person with diabetes, the pancreas produces little to no insulin. So the insulin that's injected into their body can help to cover for the pancreas when there's not enough insulin to meet the body's metabolic needs. Insulin is needed for the cells in the body to convert glucose into energy. When there is not enough insulin in the body, there will be a lower conversion of glucose into energy by the cells. This is why diabetic patients have high blood sugar. Insulin tells the liver to store excess glucose in the form of glycogen for later use. But in diabetic patients, the absence of insulin means that the liver does not store excess glucose. As a result, the glucose lingers in the bloodstream. Insulin travels in the bloodstream to get the cells in every part of the body. So to get the blood sugar levels of a patient, we can do blood glucose monitoring. And during this process, it can tell us when the blood sugar levels are abnormally high, known as hyperglycemia, more than 8 units, or low hypoglycemia, less than 4 units. Insulin is injected subcutaneously in the fat layer under the skin, on the abdomen, the upper arms, the thighs of the buttocks. The reason why insulin is injected subcutaneously is because if it's injected deeper into the skin, the body will absorb it more quickly and the body cells will convert glucose into energy at a higher rate. The injection will also be more painful for the patient, and this can result in hypoglycemia. And we'll now leave it to Suzu to present her slides.
My name is Suzu. So now I'm going to present to you about adverse outcome of an insulin. So the symptoms of an insulin overdose are those hypoglycemia, which is mild symptoms include confusion of feeling as though they have brain fog, irritability, anxiety, depression, shakiness, weakness, or a jittery feeling, dizziness, a rapid heartbeat, sweating, cold sweats and chills, and last but not least, blurred vision or double vision. So if administer a larger dose of insulin, there will be more severe symptoms which include coma, disorientation, which patient will feeling a bit of confusion, and last seizures. So people who are taking insulin are susceptible to hypoglycemia when administer too much of insulin, delay in giving insulin, miss a meal, exercise without first eating a snack, and drink alcohol and an empty stomach. Other adverse effects of insulin will be loss or overgrowth of fat tissues at injection sites, allergic reaction, and insulin resistance. So now I will pass to my friends next. Thank you.
My name is Natalie, and I will present about the undesirable outcome of insulin. So what are the undesirable outcome of insulin? Firstly, feasible disturbance. Usually at the beginning of insulin therapy, one may face a blurry vision. This is due to the changes in the osmotic equilibrium between the lens and the ocular fluids. Secondly, development of hypertension. Insulin may contribute to the pathogenesis of hypertension by stimulating the sympathetic nervous system, promoting renal sodium retention, and or stimulating vascular smooth muscle hypertrophy. It may induce dyslipidemia by promoting hepatic synthesis of very low density lipoproteins. Thirdly, weight gain. This is common in one that uses insulin due to the more efficient use of calories during the therapy. Patients on incentive therapy usually will likely to experience weight gain. Intensive insulin therapy causes one increased body fat as a result of elimination of glycosuria and the reduction in 24-hour energy expenditure. The reduction in 24-hour energy expenditure is the result of insulin associated decrease in triglyceride or free fatty acid cycling and monodeoxyribonucleic glucose and protein metabolism. Last but not least, irritation on the injection site. As insulin is administered subcutaneously, it is very important to do proper hygiene before the injection, as it may lead into injury at the injection site.